Joining me now is Michelle Curie. She's with MADD Canada, the Saskatchewan branch. Michelle, you were in the consultations with the provincial government as they developed this legislation. What did you tell them in the summer when you were having those conversations? What did you tell them you wanted?
MADD Canada was really looking to see matching sanctions for marijuana impairment or drug impairment as we see with the alcohol impairment here in Saskatchewan, and ultimately that is exactly what we got. Very happy to see a zero tolerance. I think especially with it coming out and being very new to the public as a recreational use, it's important to take a really strong stance on this.
What are the dangers of people getting into this new world of legal pot and not realizing the dangers? How concerned are you about what's going to happen on our roads as far as road safety goes when this change happens next summer?
We're very concerned. We have worked really closely with our partners in the United States and some of the states that have legalized. And what we have found is Washington State, the year after they legalized, they had an increase in their fatalities from drug-impaired driving, 2 times what they had the previous year. So we definitely see an increase of cannabis-impaired driving and issues on the roads. So taking a zero-tolerance approach is a really great idea here locally, especially in that first year or so when we're dealing with it. And if changes need to be made, maybe they need to be made. But we're happy with this approach. And ultimately, it's really about education and awareness. So that's what we're working on. We have 2 radio ads and 2 public television ads that are now going out, PSAs that are talking about the impacts of drug-impaired driving.
How confident are you in this saliva test that will be available for officers to use if they suspect somebody is driving while impaired by drugs? How effective is that?
It's going to be very effective, and the nice thing about that is it just catches the recent use. So I know there's some people arguing that, what if THC is still in the blood or still being caught several days after? It's not going to be an issue. So it's going to catch that recent use, and we know that with THC, it actually dissipates from the body very quickly. So you're going to smoke, you're going to get that high, and within about 2 hours, you're down to 90%. There's been a decrease of 90% of that THC, so we're recommending waiting 4 hours before driving. And that's in all of the advertising that we're doing currently. So Bill C-46 that's being pushed forward by the federal government will give our police officers the opportunity to use those oral fluid testers, and it's also putting federal limits on drugs, including marijuana.
Is MADD changing its messaging at all as it incorporates the message we've heard for years about don't drink and drive, along with this new message about the education around driving while impaired by drugs?
Drugs have actually been an issue on our roads for quite some time, and it's over the past several years we've seen impairment with alcohol go down while impairment with drugs go up. So we're now seeing more fatalities caused by where drugs are an issue than alcohol. So we've actually made that change quite a while ago. We talk about we talk about impaired driving, and that can be on drugs or alcohol. So while the name still says Mothers Against Drunk Driving, we focus on all levels of impairment.
Is there something we're missing? A lot of people still get behind the wheel when they are impaired.
Absolutely. We recognize, it's important to have legislation. It's important to have that enforcement out on the streets, but we really have to change the culture. And so much of that comes down to education and awareness. And we're really lucky to have the opportunity to work with victims through the entire process after. And a lot of them want to make a difference. And so they're willing to come out and share their stories. And unfortunately, sometimes people need to have a story or a face connected to that incident, because sometimes it's easy to say, it'll never happen to me. And so many of the families that we work with, they believed it would never happen to them. And unfortunately, they're going to go into the holiday season without that loved one sitting around the table with them. And it's important for them to share those stories and for people to understand that this has a lasting impact and it's a choice to get behind the wheel impaired.
Thanks for your time today, Michelle.
Thank you.